For my human movement analysis, I will be analysing the biomechanical aspects of a vertical jump. A vertical jump is important for sports where jump height is an advantage. Some of these sports include volleyball, AFL, netball, and many more. A vertical jump is not only used in sport, but also used as a measuring tool to assess power and explosive strength. This jump can be viewed as a foundation movement for specific sports and other exercises, thus meaning that the execution of the skill is vital. The vertical jump itself is also built from a foundation movement of a squat, which ultimately produces the power to complete the vertical jump itself. The vertical jump is also sometimes used in a rehab program for ACL injuries. It helps in strengthening relevant muscles and acquiring adequate landing mechanisms that avoid large amounts of landing force. As this skill can be classified as a sequential movement, it has a number of phases that it can be broken into. The skill begins with the preparatory phase, which involves flexion at the hip and knee and dorsiflexion at the ankles. At this phase, gravity provides a driving force as the body is creating a downward momentum. Takeoff phase begins with hip extension, followed by knee extension and plantar flexion at the ankle. At this stage of executing the skill, gravity will begin to work against us. Airborne phase begins after the feet have lost contact with the ground. Again, gravity is working against us, trying to push our body down. Landing phase occurs once the feet encounter the ground, once again going through the squatting movement to avoid a forceful landing. Gravity is assisting us at this stage of the skill. The mechanical objective of a vertical jump is to generate a sequential force to produce momentum elevation of the body's mass, followed by a coordinated landing feet first with the body in balance. There is a large amount of biomechanical aspects that contribute to the execution of a vertical jump. These aspects are displayed in the performance criterion. Overall, the movement of a vertical jump can be broken down into 4 stages: the preparatory phase, takeoff phase, airborne phase, and landing phase. These stages are further pulled apart in terms of looking at the pure biomechanical aspects. There are many factors that contribute to the vertical jump, however, the key factors are momentum and force. The vertical jump begins with the generation of velocity from a squat. The velocity generated during the squat is then transferred to upward momentum when jumping upwards and supports the downward momentum when the body starts to decline. Through the duration of the squatting movement and jump, torque occurs at the hip, knee, and ankle, which add to the force generated for the jump. Force is one of the most important aspects of a vertical jump. The net force for this movement is made up of inertia, muscle force, ground force, gravity, and torque. Force is a key aspect as it helps the body generate enough power to overcome gravity to lift the body mass to complete the jump. Sequential force generation begins in the preparatory phase of the jump and acts in a sequential manner to generate power to assist in the height of the jump. Gravity works both for and against the body when executing a vertical jump. Enough force needs to be generated to overcome gravity when the body is ascending on a vertical incline. However, gravity assists the body when declining. Centre of mass plays an important role in the vertical jump. If the centre of mass does not remain above the base of support, it will cause an unbalanced finish, which can ultimately result in injury. The vertical jump can be viewed as a dynamic movement and must incorporate these biomechanical aspects to be executed sufficiently. My analysis is based off a comparison between Subject 1, who is a female personal trainer and group fitness instructor, and Subject 2, who is a male student with a swimming background. Subject 1 has executed the move with the correct technique, compared to Subject 2, who we will be observing and evaluating to correct their technique. Subject 2 has executed the preparatory phase with their centre of mass remaining over their base of support, which will help them keep the skill balanced, especially when it comes to the landing of the jump itself. Although, as you can see on the right, Subject 2 has inverted knees. Inverted knees will stop the sequential generation of force and potentially can cause injury. The subject's heels are also elevated off the floor, which has caused a decrease in flexion at the hip and knee and decreased dorsiflexion at the ankle. This will affect the overall force generation and the height of the jump will be decreased. The arm swing is also a technical flaw of Subject 2's jump. The subject's arms are not in the correct position compared to Subject 1. This error will affect the sequential force generation, causing a decrease. The takeoff phase was well executed by Subject 2. Extension at the hip and knee and plantar flexion at the ankle have been executed to the same standard as Subject 1. However, there is still the technical error of inverted knees that is going to negatively impact the skill. The only other error identified is again the position of the arms. They are behind in the movement, still causing a decrease in force generation. The airborne phase was poorly executed by Subject 2. Looking at Subject 1, you can see that whilst airborne, their centre of mass has remained over their base of support, whereas Subject 2's centre of mass is located in front of them. This technical error will negatively affect the landing of their jump. The errors made in the landing phase have occurred due to the errors made in previous phases. As said in the previous section, the centre of mass has not remained over the base of support, and it is evident as Subject 2 has landed very unbalanced, with heels elevated and their body falling forward. The technical error causes torque to change as it has prepared itself to adopt the movement strategies like the ankle strategy of plantar flexion, the forward and backward movement of the hips, and a small step forward to prevent a high impact fall, compared to remaining in the squatting position, which is the ideal technique as seen by Subject 1. It is important to correct this issue as injury can become prominent from an unsuccessful landing. It is crucial that Subject 2's technique is corrected, as majority of their errors have a risk of causing injury. To correct their technique, it is important to provide the subject with information on what their error was, what the ideal technique should look like, and how we can correct their errors. In the preparatory and takeoff phase, the subject's knees were inverted. This is caused by incorrect lower leg alignment and may influence the subject to ACL tears or other knee injuries. As seen in this picture of Subject 1, the knee should be positioned over the second toe. This error can be corrected by using the appropriate strength and jump training. This training should target the trunk, gluteal, quadriceps, and external rotator muscles. Subject 2 had a very unbalanced landing. This was caused by a number of errors made earlier in the skill. Displacement of centre of mass and muscle strength are the two biggest impacts on landing the vertical jump. It is important to correct this issue as there is a potential risk for injury. As the picture of Subject 1 shows, the ideal technique for landing is having a steady base of support with your arms in a front flex position and flexion of approximately 89 degrees at the hip, 75 degrees at the knee, and dorsiflexion at the ankle of 86 degrees. To correct this error of an unbalanced landing, swing arms come into perspective again. By having the adequate swing arm sequence, the centre of mass is corrected, therefore creating a more balanced landing. It is also ideal to put into place a strengthening program, which will strengthen the hamstring, quadriceps, external rotator, gluteal, abdominal, knee extensor, and hip flexor muscle groups, as the lower body has to support all the body weight declining from the jump. The subject's centre of mass was located in the frontal plane. This causes the whole body to become unbalanced, which ultimately transfers more errors to later aspects of the skill. Referring to the picture of the Subject 1, you can see their centre of mass is located through the body in relation to their base of support, which encompasses a foundation degree of balance, which ultimately enhances an adequate landing without error. The main factor affecting the centre of mass is the sequential use of swing arms. By teaching the subject the correct sequence of where the arms need to be, should aid in strengthening their centre of mass. Strengthening core muscle is also an effective way of correcting this issue, as it helps in keeping the subject's back straight on the vertical incline. Subject 2 did not have a sequential arm swing. The issues of this error caused a decrease in jump height, decreased amount of force, and an unbalanced landing. The ideal technique for adequate arm swing is shown in this picture, beginning the movement with the arms in an anatomical position and extending their arms posteriorly on the decline. When you begin to enter the takeoff phase, arms should be brought forward in correlation with extension of the hips and knees and plantar flexion at the ankle. As the subject enters the airborne phase, arms should incline to a flexed anterior position. With the adequate technique of the arm swing, the subject will benefit from increased jump height, increased velocity, and an increase in overall balance of the movement. The most effective way of teaching someone how to achieve an effective arm swing is to use the motor control observation technique. The subject needs to watch their technique and then observe a different subject who is performing the correct sequence. Arm swing is not so much about strengthening muscles as it is learning a specific sequence.